Okay, first on the agenda will be our visitors. Visitors will have 3 minutes. We have a 30-minute time limit on this, so I'm going to take them as they came in, so maybe we'll get through as quick as we can, okay? First will be Madeline Richmond. Please state your name and address when you come up.
I'm Madeline Rigsby, and my address is 1939 Ivy Glen Drive, Murfreesboro, Tennessee. I'm going into 8th grade this year. This year will also be my last year at the school I've gone to for 9 years, the Mer Francis Arts Academy. Because it will be my last year, I'd like to be able to experience it in person. I already lost the last bit of 7th grade, which would have been the most exciting part of the year. Now I'm afraid to lose my last year at the school I love. That's just one of the reasons why I want us to have the option to attend school in person. I understand we need to keep the students and faculty safe, but we also need to protect the knowledge and sanity of everyone. Before I get into this, I just want to say that I'm arguing for the students to have the option to attend school in person, not the requirement. I believe it is perfectly fine for anyone to do the online program if they wish. I'm just here so that people like myself can go to school in person if they want to. One thing we all need to keep in mind is that a lot of people will be doing the online option, meaning there will be less people at school. I've asked people going to my school to tell me if they knew for sure whether they were doing online school or school in person. I only got 9 answers. Only 4 out of those 9 said they were not doing online school. If about half of the school is doing the online program, the schools will be safer because half of the people normally there will be gone. I've noticed within myself that it's much harder to learn if I'm feeling upset or sad. Humans are meant to socialize, and if we can't, our mental health is at risk. I know a lot of people have had some nights where they stay up really late because they miss seeing people. I've even had a few of those nights. It's harder to learn when all you can think about is the coronavirus or how you miss your friends and things like that. It's harder to focus when there's no one to talk to about these problems other than the same family members we've all been stuck with for the past 5 months. Learning from a computer is hard. I haven't learned anything since March 12th. You simply cannot learn the same things from a computer that you can from a teacher. The brain naturally learns its best in an interactive environment, such as a classroom. A lot of people are trying to get into magnet schools, and it's hard to do that if they haven't been able to go to school. I don't know how the online program will work this year, but for me and probably many others, it's harder to truly learn online. Everything else in the world seems to be somewhat up and running as normal. Sports are happening, restaurants and stores are opening, and just the other day, I was at a store and the fitting rooms were open. Plenty of things that I personally would deem not essential are open, yet school, which is definitely essential, may close. Please, give us the option to go to school. Thank you for all you do for us. I hope you will consider my arguments and give us the option to attend school in person. No matter what decision you make, I'll do my best to go through with it and keep a smile on my face. Thank you.
Thank you, Ms. Rigsby. Okay. Faye Osmelik.
Yeah, good evening. So Faye Osmelik, I'm one of the physicians here at Rutherford County, 1623 Georgetown Lane. So I'd like to thank the board for giving me the opportunity to speak here as a parent as well as a physician. First of all, as a parent, I'd like to say that we all should agree that the goal of getting in-person education for our students should be something that we should all agree on, that shouldn't be any contentious about that's the best thing for the kids. But I think we should also agree that the safety of our children is a high priority as well. And we should acknowledge that these are complex decisions and there are no easy answers here. As a physician, and I deal with the heart, I can tell you that one of the things we always tell our patients is that we can never take a person's risk to 0. We can reduce your risk, but you can't take a person's risk to 0. There's always going to be a chance of something happening. There are things that you can control, things that you cannot control. You can't control your genetics, you can't control your age, but there are other things you can control. And that requires an agreement on some of the facts of life. And here are some facts. We know that COVID-19 is caught through respiratory droplets, and its primary source is entry through the eyes and through the nose. We know that this virus, that you have increased risk, the prolonged exposure that you have in a confined space where you're sharing the same air, or in crowds where you are breathing close to each other. And by way of example, in our hospitals right now, if you're in a patient's room that has COVID-19 and you are not wearing a face mask that's an N95 respirator, a face shield that covers your eyes for more than 15 minutes, you are considered exposed. I'll let that sink in for a minute. 15 minutes. You are exposed. And that means that you potentially have to be tested, follow through on it, or be furloughed. Another fact, we know that these work. There's a lot of myth out there about the mask, but these work. Other countries have shown that if you have 95% compliance, you can reduce the risk of spread of this disease. It's not perfect, but that's a fact. That's not to be argued. We do know that children do spread this virus. That's a fact. We don't know exactly how effectively they do it, but they do, and they also get it, and sometimes pretty sick. And we know that there's a significant number of people that are asymptomatic carriers of this, at least 30%, we think. Some other facts locally for you, as the board should know, that our numbers are surging in the county and in the state. The number of deaths is rising, our hospital beds are filling up, our ICU beds are filling up. We're approaching capacity in some places. Moreover, many healthcare workers are being furloughed, not from exposures in the hospitals, but from the community. Even if you have the beds and your healthcare workers are furloughed, you have a problem. I would just like to say that the American Academy of Pediatrics has guidelines for you guys. They're excellent, and they're something that you should think about, and I can hand those over to you. And my last words are, before our teachers, our staff, and our administrators join us, hopefully not in the front lines, please give some thought that make sure they have the resources and the time to do what's necessary. Thank you.
Elizabeth Coker. Okay. Nicholascote.
I give these to you guys if I want to have you look at them or see them. Piece of paper, they have graphs on them. You want to? Yep. All right, hi, Mr. Spurlock and members of the Rutherford County School Board. Thank you for having me come before you. My name is Dr. Nicholascote. I'm a family physician here in Murfreesboro, Tennessee. I come before you as a practicing physician who cares for the population of Rutherford County in family medicine, including a lot of teachers, administrators, and students of Rutherford County schools. I'm also coming to you as a father of a high school senior at Siegel High School who is actually very, very involved in school. She's one of the contenders for the valedictorian, and I'm also as a father of a elementary school teacher in Rutherford County schools. So I come to you with a lot of, I have high stakes, I guess, in these decisions tonight. Again, I want to thank you for making sure that our kids stay safe. I think that for all the people I take care of, I want to echo Dr. Malick's statement in that it's just not safe yet to send everybody back to in-person. We just got a mask mandate 6 days ago in Rutherford County, and we need some time for that to work. We need at least 2 to 4 weeks for that mask mandate for us to see our numbers start to decline. It's going to take some time, right? So with these kind of concepts in mind, I have a couple of suggestions that I'd like for y'all to think about. And this is going to sound crazy, so I apologize, okay? But here we go. Number 1, delay the start of schools until after Labor Day. This way teachers have time to get comfortable with the new distance learning platforms that they're being trained on. I'm aware that a lot of them aren't getting training until Thursday. I think that it's just important that they have the time so they can, of course, adjust their curricula and know all the safety standards and how to do things in their schools. Number 2, I think that we should start schools with distance only until the end of the first 9 weeks. I think that it would be very helpful for y'all to just go ahead and call it so that families can make their decisions, so that teachers can plan, so that we can all know that it's the first 9 weeks, that's it, okay? After that, we'll reassess. We need our percent positivities, which is the number that we track in the medical community, to be less than 10% before we start thinking about changing to a hybrid model. And if we can get it down less than 5% before we really think about in-person. Another couple things are, I know I have a few seconds left, is those graphs that I sent you, or that I gave you. The big one there that has all the pretty colors on it is important. The reason why it's important is these are the curves that we have of upper respiratory infections and flu over the last 5 years from the Murfreesboro Medical Clinic where I work. And I'm not here representing MMC, I'm here representing me. So I just want to make sure I make that very clear. But this is data for real patients that are taken care of here in Rutherford County. The reason why that's important is that you see that we should normally in July, June have 0 respiratory infections, very little, okay? But right now we're seeing tremendous quantities of respiratory infection just from COVID. And I know my time's short, but I just want to make sure that it's very clear that right now we shouldn't see much, but we're seeing a lot of respiratory infections. Until we get our mask mandates, right? You can look there and see on the green curve that in March, as soon as we sent the kids home, the numbers dropped. Our respiratory infections dropped. They plummeted. They didn't do that nice decline like they normally do. They plummeted, right? So that worked, right? So we know, and I'm sorry, I'll get done in a second, but I just want to make sure that this is real clear that then if we can get in front of this, right, we have to get in front of this before October, right? Because October is when the flu season kicks. It's when we start seeing all the respiratory infections come up, and it's thousands of infections that we see just in a normal year outside of COVID. And so that's why from a data standpoint, it's so important that we just want to make sure that y'all see that, okay? I'm happy to answer any other questions you guys have after that. Thank you.
Thank you. Lisa Adair.
Good evening. My name is Lisa Adair. My address is 1916 Colin Avenue in Murfreesboro. I am a parent of 3 children, one in each of the 3 Rockvale schools, and my husband is a counselor at Rockvale Middle School. So like everybody here, I've got a lot of skin in the game. At the last meeting, you contemplated kicking the enforcement of masks down the line to principals of the schools. You subsequently decided, and rightfully so, to keep this a board-level decision. I'm here to ask you, please, to never make pandemic-related policies a principal-level decision. For the obvious reason that they need to be focused on their school, the professionals that work in their building, and the children that we've entrusted to them. But they do not have time, nor should they have to take any time to fight with every parent that wants to shove their unmasked kid through the schoolroom door. But I'd like to discuss a less obvious but more important reason this needs to stay a board-level decision. The school board is beholden to voters, principals are not. Why is that important? Earlier this week, in a Facebook group of parents for our CS students, a screenshot of an email from a board member to their constituent was posted by that constituent. I have since emailed this board member to confirm with them whether it was in fact an email from them. I never heard back from them. I'm happy to send the screenshots wherever. The email had the usual platitudes: appreciate your thoughts, we need to hear from more parents, etc., everything that you would expect. It was the last paragraph that disturbed me. Quote, I am looking for a medical expert that might come and help dispel the hype and misrepresentation that I believe is going on with the virus numbers. Close quote. My concern is the use of the inflammatory words hype and misrepresentation with regards to this virus and the information that is being given to us from doctors and government agencies and health departments. This board has heard from many accredited, licensed, degreed, experienced doctors who are in the hospitals and are on the front lines and have kids in this system. And those words label them as liars and misrepresenters. This board has stewardship over our children and the adults that work in this school building. In your personal life, you can ascribe to any theory you want. But when you are a school board member, use of these words suggests that you may not believe this virus is as serious as it is being presented to us. And that leaves me with a disquieted feeling that when it comes time to make decisions related to this virus. The parents and employees of this county may not be able to count on you to make the best decision when it comes to their health, and I want those decisions to be accountable to voters. Thank you.
Thank you. Natalie McDowell.
Natalie McDowell, 221 Seminole Street. I'm here tonight in support of returning to school via distance learning. We hear a lot about how distance learning is not effective, but I know that distance learning can be successful. I teach AP U.S. History and dual enrollment U.S. History in one of our Rutherford County high schools. When school buildings closed in March, my students continued working. Even when Rutherford County Schools said that the work was optional, these students continued to complete assignments and stay in contact with me. For the dual enrollment students, they knew that they must do their coursework and that it was not optional if they wanted to receive their credit from MTSU. 100% of my 89 students that were enrolled in my course completed their assignments every day. If they had questions, they contacted me and I was available to them. My AP students continued to work even though they knew that their work was optional. We met through Microsoft Teams. We contacted each other through email and Remind. They wrote essays and sent them to me for feedback, and I read them and gave them feedback. And they continued to work even though it was not required. Out of my 40 AP students, 39 of them took the AP exam in May remotely from their homes. I'm sure that my students were not the only ones in Rutherford County to step up to this challenge. I believe there were many teachers and students at all grade levels who saw similar success. Our situation was not ideal, but we did the best we could with very quickly and with the resources that we had. Since March, many teachers, including myself, have been seeking out more effective ways to teach remotely. We've attended summer professional development webinars and done research on our own to make sure that we can reach all of our students. Our school level leadership has been great at communicating with and involving teachers in preparation for the upcoming school year. As a district, we will be better prepared for distance learning. We will have a consistent approach by all teachers using KIDM, and we will all set the expectation from the very beginning that this work is not optional. If we begin the school year learning remotely, it will be nothing like the remote learning of the spring. I agree that in-person teaching is the best. However, students will not get the best version of their teachers if we're preoccupied with concerns over health and safety. I always want my students to have me at my best, and the only way that can happen is if I do not have to worry about exposure to the virus and can focus on teaching and learning. Beginning the school year remotely is the best option in our current situation. Have faith in your teachers because we can make it happen.
Thank you, Ms. McDowell. Neva Cook.
Geneva Cook, 4756 Forsman Court, Murfreesboro. I'm beginning my 26th year teaching, the last 20 of which have been in Rutherford County. Something I know for sure is that teachers have a lot of pride in their work, pride in helping a student learn a new concept, pride in helping students get the resources they need, and pride in continually learning new ways to teach. Now we can also take pride in being deemed essential. We, of course, have always thought so. Receiving a free public education is one of the most important rights that Americans are afforded. It is one of, if not the most important right that we have. In order to appropriately teach students, several things have to happen. There have to be students to teach, trained teachers to teach them, and a safe place to do so. Tennessee law provides teachers with a Bill of Rights. I won't read them all, but one stands out. The teachers be able to provide students with a classroom and school in which educators and students will be safe. How can we not err on the side of caution when we know the disease will spread? Opening school in a traditional manner, where some schools house thousands of people, is not wise. The only question is the magnitude of the spread, and there's just too much that we don't know about this illness. Teachers do not want to abandon traditional school. We know that is best for students, socially and emotionally. We just don't want to rush headlong into a questionable situation. If teachers feel unsafe, their ability to teach will be impaired. If students feel unsafe, they will not be able to concentrate. I can assure you that the teachers in this county will rise to the occasion and do all essential tasks to educate students remotely. We will make it relevant, engaging, and even on occasion, fun, much like in-person school. Until our cases in Rutherford County head into a downward trend for an extended period, I believe we should begin the year with distance learning until we mitigate this disease. Thank you.
Theresa Manning.
Good evening, Theresa Manning, 8740 Burleson Lane, Murfreesboro. I didn't plan on speaking, so I just wanted to, I have 9 grandchildren in the Rutherford County schools. Every one of them want to go back to school, desperately. I have custody of my 9-year-old grandson back here, and he's slipping, he's getting more and more depressed in the last couple of months. I've had to seek medical help. He's getting very, very withdrawal and depressed. He wants nothing more than go back to school. We did the online learning when the schools closed early. We've done everything to remain active, but he really, really wants to go back to school. And each one, I have grandchildren from 12 to 5, and they all desperately want to go back to school. So I just appreciate it if you would consider that. Thank you.
Thank you. Shannon Hall.
Hi. Sienna Hall, 111 Ridge Park Court. I'm here as a mother and a teacher. When the last board meeting ended, I sighed a big sigh of relief. I want to thank you for that. I thought, great, masks are mandated. We can go back to school. We can get back to normal. And then this past week, I've been reminded that we're nowhere close to normal. More doctors are urging schools not to reopen in person. The case numbers are still rising. We're seeing more infected children. And then there's that Marlins baseball team. If a professional sports team with money and resources can't keep the virus from spreading on their team, what chance do we have in our public schools? So there's no perfect solution. What are my priorities as a mother and a teacher? I have 3. First, health and safety. I wholeheartedly believe my principal and this district have done everything they can do to make it safe for us to return in person. However, putting 2,000 people plus back in our school building is a risky experiment. I don't want us to be guinea pigs. There are people who are saying if teachers are too scared to go back, they should get another job. Some of them are. The rest of us are scared. If all of the scared teachers quit, there's not going to be many of us left. I'm asking because I believe as individuals we'll be safer to learn and teach at home that we start online this quarter. Secondly, there's the issue of consistency. We're all missing routine and predictability. These many months of uncertainty have been exhausting for parents, teachers, kids, everybody. Unfortunately, I don't think reopening schools in person is going to provide us the consistent routine that we're all craving. Looking at the trends in the cases in the county's action plan, it's only a matter of time before we have to start closing schools. We have no idea how often and how long these disruptions will be. If we start school online, we can start a new routine. Last is the issue of the quality of education. As a mother and a teacher, that matters. We look at last spring and think online learning, not gonna work. But what's different now? We teachers have had time to prepare, and we've got a few more weeks to prepare. Like Natalie said, we've been doing courses online over the summer, trying to learn, trying to get prepared to make it the best it can be. We are eager to make online learning for the students of Rutherford County the very best it can be. Because we care, we've always cared, and whether we have to care from home or care from a school building, we're going to keep caring and doing our job the best we can. None of the options are optimal, but as parents and teachers, we're on the same side. We want to get back into our schools. We want to be safe. We want that routine. And we want a good education for our kids. But I think at this point, the best choice to ensure those factors, as well as the safety of our community at large, is to start us online. Thank you.
Thank you. Okay, that's all of our speakers. Hey, Mr. Spurlock, reopen plans for school.
All right, Board, as you know, I've been providing you data daily, in terms of where we are, and you know the options. So at this time, I'm going to turn it over to you guys.
Mr. Chairman,
Yes, ma'am.
I'd like to make some comments before we move forward. I am a mother of 3 Rutherford County students. To say that arriving at a decision has been difficult is an understatement. I'm putting my kids and my grandkids essentially back into both Rutherford County schools and Murfreesboro City schools. I appreciate all of the educators who have spoken to us today. I appreciate the young lady who spoke to us today. Y'all make very valid points. I've gone back and forth. I've been very upfront with everybody I've spoken to about being uncertain about my decision. And I spoke to somebody this morning, and that changed. Because we had a conversation about what are we basing our decisions on and who are we? We are the Rutherford County School Board. We work in education. We don't work in medicine. We don't work in any other industry. I mean, we do personally, but education is our task. Education is what we do for our community, and that has to be taken seriously. I agree, all teachers are essential. Education is essential. And we do more than educate, and I appreciate and I'm thankful for every educator, every principal, every administrator, every EA. We do more than educate. We help students with mental issues, kids who have mental health issues. We help with nutrition, we help with safety. The policy committee met earlier today, and we discussed identifying child abuse and re-looking at how we do that. All things being considered, the CDC gives us guidelines that we need to go back. We need to do some things. We need to mitigate the spread. A week ago, we looked at adding masks as a mandate. I personally wanted to see that being done on a local level for the reasons that I don't know who it was who spoke about it, but for those reasons. In the end, we ended up mandating masks. But what I know that we've done is in mandating those masks, we've said that this will mitigate the spread. We're going to protect our kids. Let's just get masks. Let's get masks. Okay, so we're doing masks. I'm teaching my kids to wash their hands, as I hope everybody else is. Don't touch your face. Respect people's space, person. And in the end, it's a community effort. We all have to make that effort. We gave parents an option when we initially went back and made a decision. We gave parents an option to choose virtual school if it worked for you and your family, and I still encourage everybody to do that. We also gave parents an option to send your kids back to school. Mr. Spurlock can speak to the number of how many students have taken that option for our distance learning program. That's in addition to our virtual school, and that's in addition to our homeschool students. So population is going to be different when we go back to school. I spoke to some pediatricians, healthcare professionals in the community, and depending on who I spoke to, I got a different perspective. That is very hard for somebody not in a medical field to make a decision. So, having said all that, and understanding that I'm going to put my children back in school with the rest of you and the rest of the parents who make that choice. And I'm going to work very hard and trust that the teachers and the principals and the administration and everybody involved is going to make the best possible decision and implement the best policies and procedures in their institutions to ensure that we mitigate this as best we can. I had a pediatrician tell me that they didn't know when this was going to end, but what's the harm in going to school online for a year? There's a lot of harm. When my daughter was in 8th grade, one of her classmates took his own life.
I've gone to the funeral of that child, and I never want to do that again. And I'm not suggesting that every child will be in that place. But I've been asked, if you save one life, what's better, the safety for all? Every life matters to me. So as hard as this decision is for me, I'm going to make a motion, Mr. Chairman, that we move to proceed with the opening of schools on August 10th, with the distance learning option being made available to parents and authorizing the director of schools to make adjustments to the reopening as the administration determines appropriate.
I'm going to second that motion, Mr. Chairman.
Thank you. Any discussion?
Mr. Chairman.
Yes, ma'am.
Ms. Johnson, thank you so much for those words. Very appreciated, and I think they're very pertinent too, especially coming from a parent. And I just want to, I guess, make it very clear that I do appreciate also all the medical input that we've got. Respect all of these doctors very, very much, and you're absolutely right. We as a board can't make medical decisions. However, and we certainly can listen and should listen to their advice. But this, like with so many other subjects in the medical field, there are many, many different opinions and thoughts out there. And we had, or the board all received a letter, or an email, I guess, if you will. He actually sent it in the form of a letter. And I have never met this gentleman before, never spoken with him until we got this email from him. But I would like to read it because I just think it's another interesting perspective for us to all think about. And this letter came from Dr. Seth Kolka. Dr. Kolka is a chiropractor, owns a chiropractic business here in town. And he says, "Dear school board members, I am a father to a super excited second grader in brand new kindergartner starting school next month. I am thankful to the board for your unanimous decision to reopen our county schools in this way. This approach is the most healthy for them, both mind and body. I recognize that you all stuck your necks out for our kids, and we plan to send our kids back full time, so thank you!" Exclamation point. I am writing today because, like you, I am concerned about the safety of our children when they return to school. As a physician, I am uneasy with the decision to mandate face masks for all students K through 12. Let me be clear. Face masks do not effectively block the transmission of viral respiratory particulates, and they should not be worn by healthy individuals. Medical science shows us this.
This is a chiropractor, just to be clear. I mean, I'm not trying to be rude, but like, he is a chiropractor.
Hey, that's enough, that's enough.
Okay, sorry.
You're gonna go to more funerals. That's enough.
Medical science shows us this. Some of the most renowned doctors across the globe are
Go to more funerals.
to these facts. Russell Blaylock, MD, a renowned neurosurgeon, had this to say about the science of masks. As for the scientific support for the use of face masks, a recent careful examination of the literature in which 17 of the best studies analyzed and concluded that none of the studies established a conclusive relationship between mask respirator use and protection against influenza infection. I'm going to skip through the rest of that to move on. Even the experts from whose information we now derive policy began by recommending against community wearing masks. There's no reason to be walking around with a mask. Infectious disease expert Dr. Anthony Fauci in an interview with 60 Minutes. The World Health Organization said in 2019 for healthy people, wear a mask only if you're taking care of a person with suspected 2019 COVID infection. On February 29, 2020, the Surgeon General of the United States of America said masks are not effective in preventing people from the coronavirus. And the Center for Disease Control, who we seem to rely on a lot, has provided papers stating the lack of evidence proving effectiveness of face masks in reducing viral particulate transmission. There is zero coherence, and zero science in play when community mask wearing recommendations are made. Fact and scientific evidence has been replaced with the idea that something is better than nothing. This approach to a serious healthcare issue is not a good public health policy. Reasons being, there are many proven and unhealthy side effects of mask wearing. Face masks make it harder to breathe, increasing the workload of our respiratory system and bodily stress. Face masks inhibit the flow of fresh oxygenated air into our lungs. Likewise, masks inhibit the body's ability to exhale unhealthy particulates it is trying to rid itself of. Each of these decrease the immune system, thereby rendering us more susceptible to sickness and disease. I urge you to please consider the published scientific research and script policy based on sound understanding and consistent proven information. Our kids' health depends on it. Thank you for your time and your service to our community. In health, South Coca. Dr. Coca asked that I read this evening because he wanted to be with us in person, but was leaving on a family vacation and unable to do so. I know we have a motion on the floor, and I support that motion. I know it's already been said.
Anyone else? We've got a motion and a second. Ms. Hopkins, call the roll.
Mr. Jordan?
Yes.
Ms. Moore?
Yes.
Mr. Young?
Yes.
Mr. Hodge?
Yes.
Ms. Johnson?
Yes.
Ms. Sharp?
Yes.
Mr. Estes?
Yes. Motion carries. Okay. Review of school calendar.
All right. In respect to this decision, we are requesting a modification of our calendar. August 10th, 11th, and 12th, 13th, and 14th be modified, being the August 10th being a 2.5-hour day, August the 11th, 12th, 13th, and 14th being 3 hours and 15 minutes. This would provide us opportunities to look at the ways we're attempting to mitigate this virus and making sure that if there's some things we need to change, we will change. I'll also add, as of this afternoon, prior to the board meeting, we had approximately 9,200 who have signed up for distance learning. That is only somewhere between 17 and 18% of our total enrollment. So I'm respectfully requesting that the board look at the calendar and recommend the approval of this modification as presented.
Any questions on the calendar?
Yeah, Mr. Chairman, and Mr. Spurlock already answered this question, but I'd like to answer it publicly. With safety precautions being put in place, our parents will not be on campus. They'll be able to drop their students off, but it will be unlike what we've seen before, correct?
Yeah, in our plan, the on-campus, in terms of people coming on campus, would be very limited. Obviously, there's some that would need to come on campus, but it would be very limited. There also, we would be using, and I applaud these principals that are in here. They've worked hard on this plan. Now, with any plan, I listened to the governor this afternoon. That is not going to 100% prevent the virus. I just want to make that clear. That's not going to 100% prevent this virus from spreading. But going back to what you asked, that we will be using all the protocols that we have in our plan. That it's been posted on the district website. It's been posted on the individual schools website, and we'll continue working through that. I don't know if that answered your question or not.
I think it does, and a kindergarten schedule for transitioning in will be provided.
Right, when we phase them in, exactly.
Perfect.
We would have to set, I think, Ms. Haley, you here, we scheduled that, did we not?
Yes, sir.
Okay.
Any other questions?
Mr. Chairman, if I may, thank you. I had a question from a teacher, and I know Mr. Lee had spoken about this before, about buying in bulk. They were asking, and what she was asking was the disinfectant for the desk. We are also giving hand sanitizer and things like that, correct?
That is correct.
Okay, that's what I thought. Also, I've had several teachers reach out to me and ask for a relax in the dress code. I mean, we're going to have teachers cleaning desks and things like that. I think there was some mention of scrubs before. I think that's something that we can acquiesce on that make it easier for our teacher, especially if they're going to be using, I mean, if we run out of disinfectant, Mr. Lee said that we have bleach, which, I mean, everybody uses bleach in their home. But if we, expect our teachers to do the cleaning, I would probably ruin my clothes within a week. And I know there's been some principals that have said yes or no, so it just really depends on what school that you're at.
I think, once again, we talk about the principal and the teachers are going to be the ones that are on the front line. I think this should be left to a principal decision, not the school board.
Okay, anything else on the calendar?
Got a budget amendment.
Go ahead, Mill, we got to vote on the calendar.
Mr. Chairman, if I may, real quickly, before we go on to the budget amendment, I know, and since we voted on returning to school as we had previously decided, I don't know that this is really a question or not, but perhaps it is in the event that we do have to move backwards if something were to happen. But I know I've had a lot of our SPED EAs and also parents with special needs children that attend our schools asking the question of, what's going to happen if we do have to, goodness forbid, close the schools, and those students that have those services that are so desperately needed that obviously can't be provided in the home if we have any kind of a game plan.
We do have a game plan. We have several game plans to address that. Ms. Kozabowski was not able, you want to speak on that, Ms. Kozabowski?
Yes, actually, our staff has worked really hard on looking at multiple options, and all of it hinges on individualized decision-making. So the state has provided guidance that we need to make contingency learning plans in the event that there needs to be closure. So each student would have to have that added to their IEP. And that said, we've looked at several options. We've successfully used some technology over the summer for summer services. And again, a lot of students can access a lot of those programs just like the gen ed students can. We often have to partner with our gen ed teachers so that they're planning and remembering their accommodations and their modifications as needed. And then the teachers, we're working on training pieces for all of our teachers so that they can provide services virtually if need be, using the distance learning plan. And then if students needed in-person services, we could consider a homebound option, or we could consider maybe some, on a very individualized basis, coming into the school.
Thank you for that.
Do we need to vote on this? Okay, we have a motion to approve the calendar. Thank you.
Second.
Thank you, ma'am. Motion to approve the calendar in a second. Any other discussion?
I would like to discuss something here. I think we need to also consider if something does go wrong, just like Ms. Moore was talking about, that we give our director of schools, I'd like to give him the authority to temporarily close individual schools, multiple schools, grades, classes, should the administration determine that those circumstances warrant.
If I might, we adopted a policy over the summer exactly addressing that concern. So we changed our policy related to emergency closure to grant Mr. Spurlock the ability to do individualized school closures to a district closure. And so that we've got that ready to go.
Okay, so we don't need to make any motion here to get that approved. It's already approved.
It is approved. That's correct.
So if anything happens, we do not have to pull this board back together. He'll be able to make
That's
the
exactly
decision,
right.
make the call, just shut it down.
Yes, yes, sir.
Ms. Young. Okay. Ms. Hopkins, call the roll on the calendar.
Ms. Sharp? Are we voting on the calendar?
Approve the calendar.
Yes. Ms. Johnson?
Yes.
Mr. Young?
Yes.
Ms. Moore?
Yes.
Mr. Jordan?
Yes.
Mr. Hodge? Mr. Issis?
Yes.
Okay, on the policies, which we went over in policy committee meeting just a few minutes ago, would be all right, Mr. Spurlock just read the policy and the number, and let's vote on all of them at one time. Would that suit everybody?
Mr. Chairman, there was one policy we were going to make a verbal amendment to.
Yes, if I may make a recommendation, I think a group vote on all the other policies would be fine, but we'll pull number 3 out for an individual vote, and I can read, before we do that vote, some proposed language that Mr. Reed pitched my way, thankfully, so that might be.
Which one are we pulling out?
Number 3, which is policy 3.2041.
Okay. This will be on all policies except number 3 then. Okay, Spurlock.
You want to follow up with, and explain what we're doing with that so that everyone else wouldn't end the
Absolutely. These policies are all recommended by our policy committee. Traditionally, we want these policies to go through 2 readings of the board so that the board can see those policies, have discussion, and come back. These policies we've pulled from that master list of policies to be adopted in 1 reading under our emergency adoption policy. The reason for that is many of these either have a requirement that they be in place by the time school opens, so that would be our Title IX policy as well as our child abuse policy. We want to make sure that day 1, teachers have in their hands the guidance, and principals have their hand the guidance, those new federal rules and state rules. And the other are tied to our opening. So they are safety procedures, code of conduct procedures, all related to COVID, as well as attendance for our distance learners. So we definitely want that to be in place so principals can start to incorporate those changes now rather than having to wait to see if the policy changes. So that's why these are emergency.
Okay.
Recommend motion to approve policy 6.200 attendance, policy 6.409 reporting child abuse, policy 6.3001 epidemic code of conduct supplement, policy 6.3041 Title IX and sexual harassment. Recommend motion to adopt these policies as read, effective immediately.
So moved. Thank you. Any other questions? Ms. Hopkins, call the roll.
Mr. Jordan?
Yes.
Ms. Moore? Yes. Mr. Young?
Yes.
Mr. Hodge?
Yes.
Ms. Johnson?
Yes.
Ms. Sharp?
Yes.
Mr. Estes?
Yes. Okay, we need to go back to the 3rd one now.
Number 3, the language that Mr. Reed and I would like to propose to you. Item 5 of the policy, it previously read, this policy shall automatically expire on the last day of the 2020-21 school year. We are proposing that as adopted by this board, it will read, this policy shall automatically expire on the last day of the 2020-2021 school year or at such earlier time as deemed appropriate by the director of schools. So that would be the form of the policy if this board approves it, which would allow, in a world where we can lift that mask mandate, to be done earlier.
Thank you. Okay, do we have a motion on that or any discussion? Have a motion?
Move to approve.
Thank you. Thank you. Okay, Ms. Hopkins?
Mr. Jordan?
Yes.
Mr. Hodge?
Yes.
Ms. Moore? Yes. Mr. Young?
Yes.
Ms. Johnson?
Yes.
Ms. Sharp?
Yes.
Mr. Estes?
Yes. Okay, budget amendment.
All right, the budget amendment involves transferring of $1.5 million of unassigned fund balance from our general purpose school fund into our centralized school cafeteria fund. The purpose of this is to provide cash flow. We know that we have currently 9,200 that are doing distance learning. That may grow. Obviously, when we open up, we probably can expect there may be some closures. So we have to make sure that we have enough cash flow in that account to meet the needs of that department. Motion to approve the transfer up to $1.5 million of unassigned fund balance from the general purpose school fund into the centralized school cafeteria fund as presented for the continued operation of Rutherford County school nutrition and department as detailed above. For those of you that maybe have not heard this, by statute, we can only carry 3 months of cash flow over into the next year. Obviously, if we don't have X amount of kids purchasing lunches, that restricts us as far as our cash flow. We do get reimbursements for the federal health, and I don't know the term for it. Federal, what is it, Doug? It's
The USDA reimbursements for the meals served?
Right.
Yes, sir.
For our free and reduced population. So this provides us an opportunity to have a cash flow in case we need it.
Okay, we have a motion.
Move to approve, Mr. Chairman.
Thank you. Second?
Second.
Thank you. Any other questions? Ms. Hopkins?
Ms. Sharp?
Yes.
Ms. Johnson?
Yes.
Mr. Young?
Yes.
Ms. Moore? Yes. Mr. Jordan?
Yes.
Mr. Hodge?
Yes.
Mr. Estes?
Yes. Okay. TSBA meeting for August 1st has had a conflicting problem, so we will not be meeting on that day. One thing I would like to say before we leave here, I want to encourage our students, faculty, staff, visitors, anybody in our building to make sure they wear their masks. We want them at the end of the year to have graduations. We want to have proms. We want them to go to ball games. So all the cooperation we can get and the help we can get, we will appreciate. Thank you. With that, we are adjourned.